Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about urinary tract infections, or UTIs. What are some of the causes? What are some of the preventive methods you can use? And what are some of the supplements that we can utilize to help prevent recurring UTIs? So here we go. Prevent UTIs, natural methods. Urinary tract infections are the most common outpatient infections in women. 50 to 60% of women will get a urinary tract infection in their lifetime, and many of them will get recurrent urinary tract infections. In men, maybe 3 out of 25 men will develop a UTI in their lifetime. What are some of the causes of UTIs? It could be viral, bacterial, or fungal. It can impact the urethra, bladder, ureters, or the kidneys. So that's going from lower all the way up to the kidneys. Once it gets to the kidneys, it can be dangerous, so it needs to be addressed immediately. Okay? So when we look at this, it says viral, bacterial, and fungal. And if you take antibiotics and you continue to have recurrent infections, you must consider maybe it might be a fungal infection rather than a bacterial infection. One of the ways you can test for it is to do a urinalysis and then followed by a urine culture to determine what type of bacteria or fungus is impacting the infection. Symptoms: urgency with low volume. So you go to the bathroom, you pee maybe a little bit, and then you turn around, you got to go back again and pee. So those are the patients who have urgency, and then the smell and color of the urine will change. So the color might be very cloudy or kind of whitish tinge to it, and there might be a certain smell or foul smell associated with that. Some women will see blood in the urine, a slight tinge of pink, burning and pain upon urination. You can have fever, pressure in the lower abdomen, and as we get older, you might be having confusion, fatigue, and shakiness, right? And a sudden onset would cause that. Rapid onset of UTIs also are associated with anxiety and depression. So if you have a lot of anxiety, depression patients, it could be associated with frequent urinary tract infections. Now, what increases the risk of recurrent UTIs or urinary tract infections? Age of onset. If you get your first UTI before the age of 15 or equal to, then you may have recurrent urinary tract infections. Diabetes. Frequency of intercourse or multiple partners may also increase the risk of UTIs, especially in younger women. Incontinence, very common in women post-pregnancy or older women. So you may have to do pelvic floor exercises to help strengthen the bladder and the pelvic floor to prevent the incontinence. Polycystic kidneys, and then spermicides. Frequent use of spermicides will also increase the risk of urinary tract infections. Okay, prevention-wise, some suggest that a vegetarian diet might be helpful in preventing UTIs, and that's probably because of the fact that there's less E. coli in vegetables versus, let's say, pork or chicken, and then less acidic diet, okay? You have to have proper hydration. You have to be able to flush your system frequently, and you have to drink enough water. So I would recommend about half your body weight in ounces of water. So if you weigh 150 pounds, 75 ounces of water per day, not in coffee or fruit juices. We're talking about purely water. And if you exercise, you'll probably need more than half your body weight. Elimination of soft drinks, alcohol, coffee. Okay? It's very important to do that. Proper hygiene. So being able to be clean and sanitary, as well as wiping. So you don't want to wipe from back to front. You want to wipe from front to back in order to prevent the translocation from the rectal region into the urethra. Tight clothing can sometimes cause increased urinary tract infections, so looser fitting clothing, cotton clothing may be helpful in terms of preventing UTIs. What are some of the supplements that we can use to prevent recurrent UTIs? Cranberry juice, pure cranberry juice or cranberry extracts can be beneficial. Probiotics, the ones that typically are mentioned in the literature is the lactobacillus species that can be helpful. Berberine can also be helpful, as well as blueberry and uva ursa. That's an herbal remedy that can help in terms of preventing and minimizing recurrent infections. So at the end of the day, it's about prevention. And then if you have an infection that keeps reoccurring, look to the cause, right? Is it my clothing? Is it my sanitary habits? Is it multiple partners? And you have to really look at it. Also check your blood sugar. Make sure you don't have diabetes. It's important to check all the boxes off to prevent this recurrent vicious cycle of infection, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.